crisis levels in many parts of the country, including parts here in Florida. What federal strategies would you prioritize to strengthen access to mental health care and community services?
Well, first of all, I think this goes back to having universal health care. There's a lot of people who need like these services. A lot of people don't have the money to pay. Like if you're gonna go to a psychologist, you might not have the money. So again, this goes back to universal health care, I think, would help a lot. You know, my mom suffers from bipolar disorder. So I know what it's like to deal with somebody with a mental disorder. You know, she needs to take her pills. Thankfully, she has coverage, but a lot of people don't. So yeah, I think universal health care would help a lot in that area. And we need to really make people feel comfortable to seek help, because also there's, in our society, like there's a lot of, you know, like this mentality where you shouldn't ask for help, especially if you're a man, like, oh, it's not manly to go asking for help. Like, no, forget about it. If you need help, go seek help. But the help needs to be widely available. It needs to be at a price that people can afford so that they can get the help that they need. We need to take it seriously, and we haven't been taking it seriously for a long time. So yeah, I think having universal health care would help with that big time.
I'm board certified, I'm quadruple board certified, so osteopathic manual medicine, sports medicine, pain medicine, and addiction medicine. The pain medicine and addiction medicine I undertook when I began working at the VA, actually pain medicine before, and addiction medicine during my tenure at the VA, because I noticed that nexus of treating pain and leading to or not doing enough to forego addiction in the future is something that was rampant in the VA. So I speak from some experience in terms of what we've seen throughout the state of Florida. When we had the pill mills all over the state, we had doctors who were prescribing way too much medication. We started off with this idea that pain should be the fifth vital sign. We put a tremendous amount of pressure on doctors to actually prescribe something for pain, but we didn't give them the resources to prescribe anything but opiates, other narcotics that were going to lead to, or at least inflame what we saw in terms of the opioid crisis and the addiction crisis. So things that we can do to mitigate that are, number one, we talked about these mobile treatment centers that you set up for folks in rural areas. You can undertake the same model in urban areas and even in suburbs to try to set up mobile treatment facilities so that people can come to you and actually receive care. Telehealth and telemedicine are extremely helpful, not just in preventative care, but specifically with addiction medicine and with mental health care. Those are avenues that are not utilized well enough, right? Because in a lot of times you're just talking to the patient, your history and physical is really more of a subjective history where you're talking to the patient and not performing a physical exam. We need to take away the stigma, which is I think what Joe is getting towards with both addiction and mental health care. Both addiction and mental health care, where people feel like they shouldn't go receive help, they feel pressure to not receive help, they feel like there's something wrong with them to receive help, whereas if you broke your arm, you wouldn't have any problem going to see a doctor. So if you're depressed, or if you're anxious, or if you're addicted, you also shouldn't have any reason to not want to go and seek help and improve your life and better your life. I think that an overarching policy where we incentivize those types of exams for primary care physicians is a great way to find those problems before they flourish, and then actually wind up with referrals to specialist care. Right now, primary care physicians are more focused on your blood pressure, your cholesterol level. They typically don't ask many questions about your mental health. So training for primary care physicians and incentivizing them to do that is also important. And then lastly, when we talk about addiction and we talk about mental health, we have to think about guns and suicide. So we have a suicide epidemic in the United States of America, especially in Florida. We see that we're going to have more successful suicide attempts in states that have gun laws that are more permissive. So making sure that the community understands that when you bring a gun into your home, although I'm definitely in support of your right to protect your home and protect your family, all statistics bear that you're more likely to take your own life with that gun than you are to take the life or stop an intruder. And I think if people really understood the risks, they would undertake that gun ownership with a great assault. They might even engage in more training and a more preemptive mental health care.
This is a hard question for me to answer. My son actually passed away in 23 of fentanyl overdose. He actually had a brain injury that he got when he was 20 and spent 22 years trying to figure out how to actually fix something he couldn't see, because we don't address mental health. Insurance companies don't know how to spell cognitive therapy. Social Security doesn't have the ability to understand that when someone has a permanent disability that impairs their ability to fill out a form and open their mail, that when they didn't respond to the question about whether or not they were still disabled, and they didn't fill out the form, so they lose their disability benefit, and they lose their Medicare, and they lose their health care, and then they die, that we have policies in place that don't make health and human life and mental health care a priority. I said earlier, I don't think insurance companies should be in the business of actually making health care decisions. Didn't say it as well, but that's what I meant. Because it's very clear there's no incentive for an insurance company to make sure you stay healthy. The only people that help you stay healthy, either mentally or physically, are your family and your physician and yourself. Unfortunately, we've delegated that to healthcare companies. And my son was being treated for pain and neurological pain at that time when the pill mills were going crazy. He had pills all over his house. Everybody in the neighborhood knew he had pills all over his house. He inadvertently ended up being a distributor, not because he wanted to, but because they were all over his house and everybody knew that's what he did. We have monopolized and capitalized on addiction by pharmacy companies as well as doctors and medical and insurance companies for decades now, to the detriment of many people that have not been able to get off of the drugs that they were prescribed. And that's a crime, in my opinion. We have limited access to mental health care so that people are at risk of actually not being able to survive. 16 hours a year of mental health care for your standard policy is not going to help someone who has long-term mental health challenges. And requiring that our military, even though we provide suicide hotlines for individuals and military, it's not enough because of the stigma that we're talking about. Universal health care could solve that problem when we get the insurance companies and policyholders out of the business of deciding whether or not you deserve the care you need. So I'm really looking forward to having that discussion with our policymakers and making sure that we make healthcare the relationship between a doctor or a physician or a psychologist or a psychiatrist, the persons that can get people through a health crisis, whether it's mental, physical, or otherwise, brought on by circumstances that do occur. So I think it is critical that we actually find ourselves in a situation where we get universal health care and get insurance companies out of the business of distributing health outcomes.
Along with what's been said already, I want to add marginalized communities to that list, because I think the issues that we have already as far as mental health goes, it almost doubles, triples, or wherever you want to go when it comes to a marginalized community and women. And Ken touched on this a little bit earlier, but before that, real quick, education and training, I think that was touched on as well, but a lot of people that I've spoken with have mentioned that doctors, we're talking just, medical doctors, but not in areas of any type of mental health or anything like that, are sort of still giving advice, wrong or otherwise, to their patients. And the patients are going with what these doctors are telling them, even though the doctors are not trained in these areas. And I think that's contributing to a lot of it as well, because for some people, a lot of folks don't understand that there's a separation there, that your doctor doesn't know what you need as far as mental health is concerned. And the doctor should not be trying to give that type of advice anyway. The doctor should be telling you, or your physician, whoever should be saying, should be addressing, hey, this is an issue for mental health, let me, connect you to this person, what have you. But a lot of people are going with the, advice that their doctors are giving and end up, in a lot of cases in a worse position than they were before. But also, along with the education and training, what's been said already, I've wanted to address a lot of the issues that, as far as women's health goes, and when we're talking about mental health there too, probably every woman in this room has dealt with an issue as far as, anything going to any type of medical doctor, any type of, physician, mental health, anything like that. And being a woman, let's be honest, is probably the reason you're having that issue. And I think we don't address that nearly enough. I saw something a couple months back where, and I can't recall specifically what it was, but it was a discussion on women's health in Congress somewhere. And the entire table was nothing but men.
Yeah.
And the first question I had looking at that picture was, why is there not a woman sitting at this table? And of course, you had your comments in there saying, well, why does it make a difference? They're trained and so forth. Let me tell you about that. My daughter is, and this is the last thing I'll say, my daughter is 18. Hopefully she won't have children for a long time, but if she does, that's just a joke, huh? But if she ends up doing that, of course, yeah, training means whatever it means, but I feel better with someone who's gone through the life experience. And the reason I say it like that is because for anything dealing with women's health, there's no way that any kind of discussion like that should happen without women at the table, without women present. So, and because life experience will come into play too, and plus women will typically trust others who have had, no amount of book training can replicate what you have actually experienced and what you've gone through and so forth. So the short answer to that is, we need to make sure we're addressing all issues, marginalized communities, and especially issues that women have to deal with regarding mental health.